This is still Dr. Mayberry, still talking about the lower limb. We are getting down there though, because we are talking about the fibula now. I have two real fibulas, not models or reproductions. Fibulas are another one of those bones that are very easily damaged, so you can see that the head of the fibula here is quite damaged. This is the head of this fibula, it's slightly less damaged. Okay? The fibula confuses a lot of people because the proximal end and the distal end look very similar if you aren't sure what you're looking for. However, as long as you listen to this video, watch this video, study in class, then you should not have an issue with anything with the fibula. Okay, so let's talk about that. So the head is the proximal end because the head is always the proximal end. But irritatingly, we do change one thing that we've been talking about so far. So with the radius and the ulna, the styloid processes were distal, but the styloid process of the fibula is actually proximal. Sorry. So this is actually the styloid process of the fibula. Also on the head of the fibula is this flat surface. Okay? This is the hole is just because this was at one point an articulated skeleton like Gertie, so just ignore that. But this is the articular facet that articulates, and again, not paying attention to rights or lefts, but it sits there on the tibia. Okay? Ta-da! All right, so that's the head. We have the shaft. There are still nutrient foramina, which do the same thing as they have in every other long bone that we've talked about. And we have an interosseous crest, again, so the crest, because we have that interosseous membrane that's stretching between the tib and the fib, just like it did between the radius and the ulna. Okay? Then we have the lateral malleolus or malleolus. So the lateral malleolus, the medial malleolus was your medial ankle bone, which means your lateral malleolus is your lateral ankle bone. And between them sits the talus, which is one of your tarsals, which we'll talk about in the next video. So this is that lateral malleolus. Okay? The way that it is easiest to tell the difference between the head and the lateral malleolus is, well, there are a couple of ways. One is that flat facet that articulates with the tibia proximally. The other is with this peroneal groove that is in the distal end. It's behind the lateral malleolus, if this is the lateral malleolus. Okay? And that peroneal groove is going to come in very handy. There's actually a tendon that's sort of wrapping around the back of your leg and bottom of your foot there. So that's what the groove is for. It's going to help us side this bone though, which is very convenient. So that is your peroneal groove back there. Right there, okay? And you're going to sit your thumb in it to side the fibula. So if I sit my thumb in that peroneal groove, take my forefinger and wrap it around here, this articular facet back here that articulates with the talus should be exposed. If it is, then I'm holding it in the correct hand. So this is a left fibula. Ta-da! Okay? So if I were to put my thumb in the peroneal groove and wrap my forefinger around it here, one, it's actually really uncomfortable. I can barely hold on to it. Two, that articular facet is like in my hand. Okay? So it is not a right. Right? That's how I side the fibula. That is by far the easiest way for me to side the fibula. And it also is super helpful because if I put my thumb there, then I'm basically holding it exactly as it is in my leg. Okay? So you're kind of putting it in anatomical position already. And you can't get confused between the proximal end and the distal end. Obviously, this is the way I recommend to side the fibula. However, you can do it another way, which I find less reliable. You can look, if you lay it down on the table like this, they say, and I guess they're not wrong, that this line here points toward the side that it belongs to. Okay? I'm not a huge fan of that, but I guess that is accurate. I like the peroneal groove better. Okay, so again, this is articulating with your tibia, it's articulating with your talus, and that is how to side it. So we've covered everything for the fibula. It's relatively few landmarks. So some people do get confused. Ask me if you have questions about the fib. Okay, and it is the fibula, not the fibia. Please do not mess that up. Okay, all right. Talk about the foot in the next video.